What research do we use and how do we know when we get information from research that is good to be used to guide clinical management and our recommendations we make for patients? Well, the first thing I'll tell you is that all doctors fall into two categories: academic or non-academic doctors. So the academic doctor is someone who works in a teaching hospital. They usually have OB/GYN residents. It's usually a larger institution, and an academic center where an academic physician works thrives and works in research. They look through these studies and they criticize every aspect of them. There are so many aspects of a research study that can make it a weak research study or a strong research study. Every study has strengths and weaknesses. Any study is subject to biases, and peer reviewing these studies helps determine, is this research good, strong, reliable, and does it give actual information that can be used to possibly guide clinical practice? Non-academic physicians are like myself, where we don't work in research centers, we don't work at large academic institutions. Many of us are in smaller community hospitals or just hospitals where research is not a core principle of what that center's function is. We are generally just seeing patients without that extra time to review research studies. So then, how do we know what to do with our practice? The answer is that we turn to our trusted societies that are established to help guide clinical management in the field of OB/GYN. So these societies are things that you may have heard people reference to, such as ACOG or SMFM. ACOG is probably what you have heard most. This stands for the American College of Obstetricians and Gynecologists. So this is a society that is formed of all of the board certified members of OB/GYN. They review research. They do all that work that is done at an academic level, but they do it in a broader level. So the one we're looking at right now, Tylenol use in pregnancy and autism, and they will look at all these research studies. In each research study, they're going to say, is this a strong research study or is it not? And then after compiling all of that data, all of that information, they come up with recommendations. So that's how doctors get their information, from known, trusted, well-established societies that have good outcomes as their goal for how they make practice guidelines. They extensively review research, they establish good research versus bad research, and they give us good information to help us guide treatment to get the best outcome. That's where these things come from. And that's why your board certified OB/GYN is the best source of information to help guide your care as an individual, not random people on the internet, not politicians.